Hello, 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 YouTube world. It's Miss Patty with 4-Year CNA, and I'm here for our live weekly question and answer session where we answer all of your questions on CNA training and testing and workplace and whatever else you got. We go live every Thursday at 3 p.m. Eastern for this session, and I'd love to welcome you. When you come in, give me a hi, hello, or your question in the chat, and we'll get to that shortly. So for those of you who don't know how this works, every week on Thursday at 3 we go live, and I'm going to answer your questions. But before we get there, I usually give a little mini lesson, and this is over some sort of a topic that's relevant to CNA training or testing. But in today's case, it's actually a question that gets asked a lot online. And I want to kind of delve into a few different workplaces, but one in particular, and that's the one we're going to focus on today. So if you have a question, go ahead and drop it in the chat. We'll get to that very, very soon. Hi, Hina. Hi, Ina. Hi. Let me know when you're here. Give me a hi, and that way I can greet you. But let's go ahead and dive right into today's lesson. So today we're going to talk about hospitals, specifically hospitals for CNAs. And this is a question that I see online a lot. Should I work in a hospital? Where should I consider working? Is a hospital a good place for a CNA? What makes a hospital different than every other place? So I really kind of want to focus on those types of questions with today's lesson. So let's go ahead and jump right in. And before we do that, I'm going to drop a link in the chat. Oops. Let me go here. I'm going to drop a link in the chat. And this is one of the things that we're going to be focusing on today is the workplace personality quiz and how it can help you decide whether the hospital is the right place for you. So let's talk about the names. And this is really... This can get really complex really fast when it comes to CNAs working in the hospital, because a lot of times what you'll see if you go on to any hospital's job webpage, and by the way, that's the best place to find opportunities in a hospital is actually going directly to the hospital's website, look at their jobs or careers section, and look up the opportunities for that particular hospital, because not all positions are going to be advertised on online jobs boards like Indeed or Monster, Career Builder, or ZipRecruiter, or those types of things, because those platforms cost money. So your the hospital's website, they already own. So that's where most positions are going to be located. If you're looking to get into a hospital, that's my number one tip. Go directly to the website of that hospital and look at opportunities. But this is where things get really, really confusing, because there are very, very few job opportunities that actually say CNA. Most of them are going to be under different names, things like PCT, PCA, NTs, PSTs, and these are all acronyms that you may not be familiar with because you're, wait a minute, I'm a CNA or an STNA, which those are the same thing. CNA is Certified Nursing Assistant. STNA is State Tested Nursing Assistant. They both mean exactly the same thing. They're just different acronyms. But when we get into the hospitals, it's important to understand that you actually, in most states, don't need to be a CNA to work at a hospital. They don't, it's federally, that isn't required to have your CNA certification. The only place that certification is actually required is in a nursing home and in some home health. But to work in a hospital, the CNA designation, that certification, actually isn't required at a federal level. So a lot of times hospitals are going to call this something completely different. They're not going to say CNA because, remember, certification is not required. So if you go onto your local hospital's website and you type in CNA, you may not see a whole lot come up because remember, CNA isn't required, so the job description isn't going to have CNA in it. So a lot of places are going to use a different designator, something like PCT, and that's probably the most common one that we see is PCT, which is Patient Care Technician. But you can also see PCA, which is Patient Care Assistant or Patient Care Attendant. Some places will call them nurse techs. I see that a lot. You have the newest one that I've seen is PST, which is Patient Services Technician. And this one is a little bit convoluted for me because when I was doing the research for this episode, and guys, I do a lot of research before I come to you guys live, I went on to about 15 or 17 different hospitals in different states and looked up their what we call nursing support staff opportunities. Now, this patient services technician, PST, patient services technician, in some places was a direct care position. So like a CNA, you're helping patients with bathing, dressing, grooming, vital signs, that type of thing. But in other places, it seemed to refer more to like a admissions clerk or a registration clerk. So this term, patient services technician, is a little bit more muddy. You'd really want to make sure that you're looking at the job description and make sure that the qualifications you have meet what they're looking for, right? So the one that I see most often is Patient Care Tech, or PCT. Now, this is something that most people don't know. PCT is not a state-regulated entity like CNA is. So CNA, you have to go to school, you've got to take the test, and then you get put on a registry. But remember, the only federal requirement for that is in nursing homes and some home care. So PCT is not state regulated like a CNA is. There is no state test. There is no mandated education, which means for PCTs, you can actually learn on the job. And we're going to get to that in a minute because a lot of hospitals now have training programs right on site where they'll take you in with no training or experience, put you through the training program, and then you'll be eligible to work in that facility as a PCT. They'll also take in CNAs into that program and train them in acute care tasks and let them work as PCTs. So if you're thinking, okay, well, I've got to go to school to be a PCT to work in a hospital, that's not necessarily the case. So you'd want to check with your local hospital where you want to work to find out what their requirements are. But a lot of them offer on-the-job training where you don't have to go to an outside school. But there are a lot of names for this one position. Now, it gets even stranger, right? So this is, like I said, this is a very, very complex subject, but it gets even stranger. So not only do we have CNAs and STNAs and PCTs and NTs and PCAs and PSTs and all of those other things, if you're working in psych, so a lot of hospitals have an actual psych unit where we do behavioral therapy and patients in crisis get get restabilized with medication and treatment and things like that. Those would be called rehab techs or psychiatric aides or behavioral health techs. And again, a CNA here is not required. They can do on-the-job training, but they may prefer that you come in with your CNA to all of these because you're already coming in knowing some basic tasks that would be required. Now, in addition to this, so CNAs kind of qualify for all of this, right? In addition to these, there are some other designators that are more for special case type situations. So that's what I want to talk to you about now. So we have nurse extern, and I saw a lot of these guys in those 15 or 17 different hospitals that I went to in different states. I saw a lot of opportunities for nurse externs, so I want to explain what that is. A nurse extern is somebody who is currently in school for RN and has completed the first semester called Nursing Fundamentals. So you would work as a PCT, but as a nurse extern, you're going to get a little bit more exposure to things that are going to be relevant to your RN training. So nurse extern is a PCT or a direct care staff member or a nursing services support person. But we know by you having that title, nurse extern, that you are in school, and we're going to make sure that by you having that title, we're going to give you a lot of additional information while you're working and make sure that you can tie together what you're learning in the classroom with what you're seeing in a clinical setting. So nurse externs is a good opportunity for those of you who are going to nursing school. But if you're not in nursing school, there's another opportunity you might want to consider, especially if you're in CNA training and you're not quite there yet, and that is a patient safety attendant. Now this one, there's a lot of job openings for this, guys, and I think it's because nobody really knows what it is. So we don't use restraints in a clinical setting unless we absolutely positively have no other option. We use patient safety attendants. So this is somebody like you that would be assigned to one patient, and you would sit at that patient's bedside and you would make sure that they have everything they need, and the whole goal here is to keep the patient safe. So a lot of times patients that are confused will try to get up out of bed. If somebody's there to distract them, to talk to them, to make sure that they can reach that cup of water, that can let nursing staff know when they need to go to the bathroom. This is a patient safety attendant. It takes the need for restraints away because the patient is well cared for. So a patient safety attendant is someone with no training, no experience. It's something you can do while you're in CNA school, and it gets your foot in the door. And that way, once you become a CNA or you decide to go through the PCT training, you're already employed by that facility, and it makes that transition into that PCT role a little bit easier. Now, transporter, same thing. Transporter is a position that you are eligible for, and a transporter helps patients into wheelchairs and takes them to different areas in the hospital for testing or for whatever else they need to do. So you are getting the patient from point A to point B either by stretcher or by wheelchair or simply walking the patient. But transporter is another opportunity for you to enter the hospital setting without having any certifications. Now, an orderly, this one I found really interesting because I'm old, right? So to me, an orderly is something that we used a million years ago. They were generally men, and they were kind of like the male equivalent of a CNA, right? But that's actually not what an orderly is now. If you see a position for an orderly and you're interested in surgery, like a career in a surgical setting at some point, orderly is something you might want to look at. And again, you would be qualified to do this with no training or experience. This is like an on-the-job training thing. And what an orderly does is it makes sure that all the supplies are stocked. They're a runner. So if something's happening inside the surgical suite, somebody would stick their head out and say, hey, go get whatever it is we need. So it's a surgical support staff position, and it's kind of a step on the ladder to scrub tech. So if you're interested in surgery settings, an orderly is a great place to start. Then we have monitor techs. Now, monitor techs work in patient settings. So, like a telemetry floor or a PCU type setting. So this is when we have those little tabs on the patient's chest and all of their heart rhythm data is being transmitted to somewhere for somebody to watch. Well, the monitor tech is the one that actually does the watching. So you would be trained on how to interpret all those little squiggly lines and notify the appropriate nursing staff if something looks funky, needs to be checked out. And again, you are eligible for that type of role because they usually offer on-the-job training. We also have something called a perioperative surgical services assistant. And again, I saw a lot of opportunities for this, and this is something that you would be eligible for with no additional training. And it would be helping patients before and after surgery, particularly in like a same-day surgery setting. There's also a central telemetry technician, which is just like a monitor tech, just a different name for it. An advanced patient care technician, and I couldn't find anything in the job description that indicated why it was advanced. But again, these are different names that you're going to see for opportunities that you actually might be qualified for. So, and then of course we have nurse apprentice. So the other one here, the non-certified scrub technician, this one, when I saw this one, I did see orderly experience preferred. So if you start out at that orderly position, then you probably would graduate to a non-certified scrub tech, and then eventually you'd work your way into a certified scrub tech position. But there's a whole lot of words here, right? A whole lot of names. And that's kind of what I wanted to get across to you with this, is that if you want to work in a hospital and all you're doing is typing in CNA, you may not be pulling up all of the opportunities that you qualify for. So we have to kind of reach a little bit beyond our one label that we've earned. We have to look a little bit further out to see what is available to us. But now that we've decided we want to, we know what to look for, we have to figure out, is a hospital the best place for me? And that's what I really want to talk to you about today. So I'm going to bring this grid up here, and we're going to talk about, that's fine, Blue. We're going to talk about some differences between the hospital and long-term care. Now, this really kind of makes me laugh a little bit because it seems like everybody wants to work in a hospital. And I get it, but I think that there's a disconnect between the reality of working in a hospital and how Hollywood portrays working at a hospital. I think that everybody kind of thinks that the hospital is going to be a very close-knit group of people. Dr. McDreamy works there, all of those things. And it doesn't really work that way. And a lot of people that think that that's really where they want to work is the hospital. Then they get in and they're like, oh, whoa, this isn't anything like what I thought it was going to be. And it kind of sets them up for failure. So I want to make sure that you have a very clear understanding of what it's like to work in a hospital before you start pursuing those options. So the first thing that we have to talk about here is acuity. Now, acuity means how sick the patients are or how much medical and nursing assistance they need, right? So acuity is going to vary widely. Of course, in your hospital, that's going to be where your most acute patients are, the ones that have medical conditions that are not under control, because if they're not under control, that's where we send them, is to the hospital. So these patients are all over the place. They may have really bad symptoms, or they may have a wound that's putting them in jeopardy, or they may have a recent heart attack, stroke that we're trying to help them with. So the hospital is a really, really high acuity setting. Now, long-term care, once we get those patients stabilized, we ship them out to long-term care. So your long-term care patients are going to be more stable, less acutely ill. They may have things that require ongoing management, but your patients, for the most part, are relatively stable. So hospital, unstable, nursing home, stable. Then we have to look at the pace. Well, because we're working with non-stable patients, the pace is going to be really high. Now, I want to talk to you brand new CNAs for a second. You're slow, and you're supposed to be slow. You're brand new. This is the one time of your life that you can be slow and get away with it. You're slow. But if you take somebody that's a brand new CNA, doesn't have much experience, doesn't have much speed, is still trying to remember how many washcloths you need for foot care, right? You're still thinking about these skills because you haven't developed a whole lot of muscle memory. Dropping you into a hospital setting may not be ideal for you. Now, there are some people, yes, that can hit the ground running and be perfectly fine, and they get into a hospital, they absolutely thrive. I get it. But for the vast majority of brand new CNAs, the hospital probably should not be your first choice. Does that make sense? You need to get a little bit of experience under your belt. You need to get a little bit of speed under your belt. And that's for you, because otherwise, in a fast-paced environment, there isn't a lot of people that's going to be able to help you or get you acclimated, and you may feel like you're drowning. So this kind of rule is for you to help protect you from putting yourself in a high-stress position, right? And then we have to look at the patient change. Now, patient change, I'm not just talking about, that they go from sick to better quickly or better to sick quickly. I'm not talking about just that, although that's a concern, because patients in a hospital, their acuity changes rapidly because they're unstable. But I'm actually talking about the actual physical patients changing, like John came in yesterday, was admitted yesterday. He's being discharged today. Betty just came up from the ER, right? So you may start a shift with 6 patients, and you may end that same shift with 6 totally different patients. That means that you've got admissions and discharges in there. So there's a lot to take into consideration here, right? You're not going to get to know your patients and then they're going to stay there and you get to see them again tomorrow, because the whole goal of the hospital is to get them in, stabilized, and out. So your patients are going to change. Now, because of that, schedules change. And we have to take this into consideration, because in a hospital, if we don't have enough patients, we're not going to bring in the staff. So here in Florida specifically, I'm going to talk about Florida for a second, we have what's called season. We have a lot of older people that live up north somewhere, New England, Canada, that type of thing, and they come to Florida during the winter because it's a little bit warmer. They don't have to deal with the weather, temperature extremes and things like that. But when they get here, they usually get sick. So during the winter months, from like September till April, in Florida, our hospitals get overflowing with patients. We need a lot of staff. But in the summer months, all those people went back home, so we don't have as many patients in the hospitals. So we tend to have a lower census, and that affects scheduling. So if you're the type of person that absolutely has to have a certain amount of hours every week to pay your bills, hospitals may not be your ideal choice. Now, if you contrast that with long-term care, those patients live there, and they live there from the time they come in until the time they go out, which is usually after they expire. So those patients are pretty stable. Henry's going to be here tomorrow and the next day and the next year and probably the 10 years after that. We tend to build a little bit more rapport with Henry because we know him better. We see him all the time. But also because those patients are very static, the patient population doesn't change. The scheduling doesn't change either. So if you're looking for that really routine, you can count on it, they're not going to cut my hours type of schedule, long-term care might be a better pick for you. You also have to look at patient diversity here. In a hospital, there are all different types of patients. There are babies, teenagers, young adults, middle-aged adults, older adults. You've got people from all different cultures, all different walks of life, all different everything. It's very diverse setting. Nursing homes tend to be a little bit less diverse. Yes, you can occasionally get a younger person in there, but it's going to be predominantly care of the elderly. And if you're in like a type of community, it may even be less diverse than that. If you're working in a Jewish nursing home, then culturally your patients are going to be predominantly Jewish. So culturally, there may even be less diversity. So if you're the type of person that doesn't really do well accommodating with people outside of your own age or culture or whatever it is, the hospital may not be the right place for you. You may be better in a more stable, longer term setting. We also have to look at complexity. Now, this is a big one. If you are the type of CNA that is scared to death about looking at all of these machines and all of this equipment and I don't know what to do with all this, it scares me to death, then the hospital is not the place for you. Long-term care might be a better fit. So you have to understand, when we have patients that are more complex, more acutely ill, we're going to have a whole lot more complex toys that we have to play with as well. So you have to be open to being able to learn how to navigate around this equipment and how to utilize it appropriately. And then we have the teamwork aspect of this. So as a CNA in a hospital, or whatever else term they want to call it, direct care staff at the hospital, you are going to be working very closely with your team, very closely, because your patients are complex and they are acutely ill and it's fast paced. So you've got a lot going on. You're going to be working with your team very closely. Whereas in a nursing home, your patients are more stable, they're less complex, it's more custodial type of care. So you're going to be a little bit more independent in your daily workflow. So if you're going to work in long-term care, you have to understand that you may not be as closely involved in a team. You may need a little bit of self-awareness for that independence, all of those types of things. So this graphic just kind of goes into a little bit more detail about what we just talked about. So in a hospital, our patients are going to be more complex. Care is going to be faster paced. Your patients are going to change rapidly in every sense. Scheduling will be affected based on the census. You're going to have a diverse range of patients. Your tasks are going to be more complex, and you may even need to learn a few things along the way. And team dynamics are going to be crucial. So we got a lot of things to consider here, just beyond Grey's Anatomy looks cool, I want to work in a hospital, right? There's got to be a little bit more there that we have to think about to figure out whether this is the right solution for us. So moving on to that, we have to look at some kind of unwritten rules. So let's say that we've decided, yes, we want to be a CNA in a hospital. That all sounds awesome. That's what I want. I want a fast-paced environment where my patients are complex and diverse, and I want to learn new things. Yes, that's what I want. Well, now we kind of have to look at this from the employer side of things for a second, right? So if we're going to work in a fast-paced, diverse, highly acute environment, it's going to require a little bit of maturity from our workers. Remember, we're working in a team atmosphere. If you are young and everything in the world is still very new to you, this may not be the best place for you, because you're going to see a lot of things, and it does require a certain amount of emotional maturity. Sorry guys, I got a tickle in my throat. So what do I mean by that? Well, your hospitals, when they put out those job descriptions, it's probably going to be 18 and older. So if you're under 18, don't even apply. But in reality, you are competing for that position against other applicants. And if you're 18 years old and you're a little emotionally immature and they're interviewing somebody else who's maybe 24 and has a little bit more life experience, the older person may get the position. You may have interviewed just beautifully, perfectly fine, but because that maturity level, they may go with a slightly more emotionally mature individual. So don't not apply for the job, but understand that you are up against competition, and that you're going to have to find a way of showing that you really are emotionally mature enough to handle this work. You also have to understand that when you're working in a hospital specifically, they are going to require a high school diploma or a GED. So if you don't have one of those, you're probably not even going to be considered for an opportunity in a hospital. They do want that little bit of higher level of education in their staff. Adaptability is going to be key here. So, and this has got to come across during your interview, particularly if you're new. So you have to be able to show that you're willing to learn new things, that you're capable of working in this fast-paced environment, that you have the emotional maturity to be able to thrive in this type of workplace. Teamwork mindset is going to be key here. They want to see that you can work as part of a team, and if you can show them that you've been in other industries where teamwork was encouraged, that would be a good thing to talk about during the interview. Experience is always going to be preferred, but this is kind of a two-edged sword. I'm going to kind of warn you on this one. Experience is preferred, yes, absolutely. Because I want you to be able to hit the ground running, ultimately, right? They don't want to spend 3 months trying to train you. But the wrong kind of experience here can hurt you, because if you're coming out of a long-term care setting and you're used to that stable work environment, if you've worked 15 years in a nursing home and you're trying to get into the hospital, they may look at that and go, oh, wait a minute, you're used to a very stable environment where your patients don't change, mainly custodial care. So all those things that we just talked about may actually work against you. And guys, I get it. And I don't have an answer for this. I know what you're saying. I know. How am I supposed to get experience if nobody will hire me, right? If I have to go to the nursing home because I can't get into the hospital. I get it. And I don't have an answer for you. I really don't. I wish I did, but I don't. It's kind of the age-old paradox. Your job during the interview is to convince them that you are the right person to take a chance on. But then you got to be able to back it up. Because if there's too many people that go in there and say, yes, you need to pick me, I can do this, I can handle it, and then you get in and quit 3 weeks later because you can't handle it, that is going to affect the next person that tries to get in, pick me, right? The hospital is going to be a little bit jaded, and they're not going to want to take anybody unless they have hospital experience. So you've got to convince them that you're the right person for the job, but you've got to be able to back it up as well, because otherwise you're going to hurt everybody trying to get in. You also need to understand that training may be provided on the job. You may just be able to tell them, I want to work in a direct care capacity. I don't have the training. Do you have any training opportunities available? Now, I'm going to give you a little hint here. If you live near an HCA hospital, so this is Hospital Corporation of America, they have hospitals in, 30-something states. They're the largest hospital group in the nation. They're massive, but they actually have PCT, what they call Star Tech, that's their program name, Star Tech, in-house training. And they actually use my book and our online program, and they do a fantastic job of training people, that want to come in and work at the hospital. So you may be able to find a training program at an HCA hospital near you, and you just agree to work for them for a certain amount of time after they provide the training. And that kind of covers all of your problems, right? It's okay to be slow because they're training you. They know you're slow. It's okay to ask questions because that's what they're there for. So this might be a really good opportunity for you to get into the hospital, is to try to find a training program. Now, there are other hospitals out there, other hospital groups that are implementing direct staff patient care training programs. So contact your local hospital and find out if they have one. I'm talking to facilities all the time that are implementing these programs. In fact, Blue just told me about one of them up in Washington State as well. So there's lots of opportunities out there. Don't be afraid to contact your local hospital if that's really where you want to work, but go back a couple slides and read what hospital work is going to be about. Don't jump in it if you can't swim, right? Student nurses are welcome. Again, you want to probably apply under that nurse extern because you want that different title so that nurses are going to be taking a little bit more time to train you as you go through. You want to apply to all positions and you want to apply often. So like on some of these hospital jobs boards or jobs listings that I was on, you would have 6 different patient care tech options in the same hospital. And they all go to different places, all of them. You need to apply to all of them because they're not going to share your application. If you're applying to 3 North, Tele is not going to see your application. If you're applying to PCU, then the mother baby unit does not get your application. So if you're interested in working as a CNA or PCT in the hospital, you need to apply to all of them, and you need to apply often, and you need to make sure that your application matches that job description exactly. Otherwise, they aren't going to take you seriously. So now let's talk about this from the employer standpoint. And this is something that most of you guys aren't really going to think about, right? So we have to think, we look at us and we go, okay, I want to work at the hospital. I'm going to go apply at the hospital. I'm going to interview at the hospital, and hopefully they're going to hire me to work at the hospital. Everything that you've just said is centered on you. We kind of have to look at this from the other side of the desk, right? We have to look at this from the employer side. So the first thing that they're going to look at is critical need. So when you're talking about getting employed at a hospital, there's 2 factors here. Number 1, how many open positions we have. And number 2 is how many applications do we have for those open positions. Now, hospitals are kind of unique because I said at the very beginning, everybody wants to work at a hospital. So there's no shortage of applications. They may not have a lot of positions open, and there's no shortage of applications. So if they have a high application rate, they can afford to be picky. So if you want to get into the hospital, you're going to have to apply often, and you're going to have to bring your A game with your interview performance. You also have to understand that they're probably not going to pay as much as other settings because, again, you've got that critical need component. If I don't have a critical need for CNAs, if I got a whole stack of applications here of people wanting to come to work here, why would I pay a whole lot of money? I'm not going to, because I guarantee you somebody in this stack of applications is going to work for what I'm willing to pay them. So when you contrast that to other healthcare settings that don't have a whole line of people waiting to get in, they're going to have to pay a little bit more. So if you're looking for a higher rate of pay, the hospital may not be the best opportunity for you. You also have to look at how the interviewer is going to see you in regards to flexibility and teamwork. Because remember, this is a team-oriented dynamic. If you come in and you're a little bit aggressive and you're not giving off, I like to work with teams vibe, if you're also kind of set in your ways and you're not flexible about your scheduling, about the tasks you're willing to do, or learning new skills, that's all got to come across in the interview, because if it doesn't, they're going to pick somebody else from that stack of applications. They also are going to ask you about your future plans. Now, I am going to tell you that this is probably one of the few industries where they actually want to hear that you're not going to stay in that position. Now, most other industries, you don't want to tell them that you're in school for something else because they're probably not going to pick you because they know you're going to be leaving. Healthcare is a little bit different. if you are looking to go to school to be an RN, you need to let them know, hey, I plan on being an RN, or I plan on being an ultrasound tech, or I am really interested in radiology. I'm going to be, a dietitian, whatever your future plans are, as long as they relate to medicine, that actually is a check in a good column for you. It shows that you're, interested in advancing your career, you're always learning, it really relays to them positive traits that they're looking for. Now, if you go in and say, yeah, I'm taking classes to be an air conditioned technician, that's not going to help you. This would only apply to furthering your career in medical arenas. Does that make sense? I hope it makes sense. All right, so let's talk about some tasks that separate CNAs in long-term care and CNAs from the hospital. So all CNAs everywhere, whether you're a CNA, a PCT, a PCA, an NT, whatever your PST, whatever your title is, all CNAs are going to obtain vital signs. They're going to answer call lights. They'll assist with personal care tasks. They're going to be recording intake and output. They'll be preparing rooms for new patients, assisting with mobility needs, obtaining specimens, and obtaining patient information. Those are pretty universal CNA tasks. But when we get into the hospital, we have to pick up a few new ones. Things like applying anti-embolic measures. This may be SCADs or TEDHOs or those types of things. Assisting with bedside procedures. Removing IVs and catheters and applying telemetry pads. These would be some extra tasks that you might have to learn to do. Yes, they're going to provide on-the-job training. They're going to train you to do these things because you probably did not learn them in CNA school. But you have to be honest with yourself. Are you willing to learn new tasks? If the answer is no, don't apply, because you need to go into it knowing that there's additional things that you're going to need to learn how to do. Now, obtaining specimens, I actually put at the top of this list, but it's more common to see it in the hospital setting. People in long-term care do still obtain specimens, but it's not going to be as frequent, and it's not going to be the amount of specimens that you will be collecting in an acute care setting. So kind of be mindful of that as well. So all of this to get here, right? So how do you know if the hospital is the right place for you? And I've created a quiz to help you with this. So it's free. Go onto the website. Here, let me put it in the chat one more time. So here you go. Take the free. It's free, guys. I don't even ask you for your email. I mean, this is truly free. So go in, answer the questions, and see what it spits out to you. Because everything that I've talked about is in that quiz in a certain way. And I've made it so that people that don't work in healthcare yet can take the quiz and identify their personality traits that would be relevant to different settings. So if you're interested in going to work at the hospital, but you're not 100% sure whether you've got what it takes to thrive there, go take the quiz. It will help you. And like I said, I'm not getting anything for this. This is something I created specifically for you guys, because this was a question I got asked all the time. Where should I start work as a brand new CNA? So that's why I developed this. And it is scary accurate. It really is. So let's get to today's questions. So yeah, here's a conclusion. You can read this. But remember that a lot of hospitals have training programs. Check with your local hospital to see. So let's see here. Hey, Blue. Hi, Hamill. Hi, Gina. Hi, Kishwanda. Jennifer says, I work as a hospital CNA. I love it overall. The only thing I don't like about it is the constant discharges and admits. Yeah. And let me tell you a little story about this. Oh, I am way late on time, guys. Sorry. I'll try to wrap this up quick. All right. So my oldest son doesn't like change. He does not do change at all. When I used to change my hair color when he was a kid, he would cry. He wouldn't come near me for like a day. He does not do change at all. Would he thrive in a hospital? Absolutely not. That is the worst place in the world for him because he doesn't do change. And with all these admissions and discharges, it can be very overwhelming. So you have to kind of look at yourself. Am I a person that likes change? Or am I a person that really doesn't like change? And you have to be honest with yourself. Don't let the idea of something convince you that the reality is going to be overcome by, by your sheer force of will. It doesn't work like that. So be careful not to get seduced by the idea of something. You've got to remain rooted in reality. So is this the right place for me, right? Let's see here. Blue says, send you the info, been busy here. Yeah, medical assistant, I do want to talk about in an upcoming episode too, Blue. Yeah. Hi, Azam. Jennifer says, in Oregon, you have to be a CNA 2 to work at a hospital. It's another class, about 2 weeks long, no state boards. You learn about 5 more skills, pulling IVs, Foley's, and I can't remember the rest. Yeah, and those are all the things that we talked about here, Jennifer. And a lot of places will change the name. Yeah, CNA 2 is used, but also patient care tech, PCT 2, advanced patient care tech. There's a lot of different names, but the names don't really mean a whole lot. It's just because they can't call you just a CNA because you don't need to be certified in that setting. So they come up with a different title. All right. Let's see here. Need to be a CNA. You work as a medical assistant, registered. You're taught very specific skills for the hospital unit. They need you to know. Yeah, that would be on the job training. Yeah. So Jennifer says, I can't work in nursing homes. It's rewarding, but it's just super hard on your body. I feel like you get more support in hospitals, just my opinion. Hospitals have much better benefits. Yeah, that's something that you definitely want to weigh. Blue says, leave the unit to a different unit. You have to be retaught the skills. Yeah, absolutely, because every place, every unit that you work on is going to have a different skill set based on the patients that they care for in that unit. Yeah, Jennifer. And for some people, the hospital is the only way to go. Absolutely. Absolutely. But not for everybody. And that's really what I wanted to kind of focus on here. You may have listened to this presentation and thought, yes, that's exactly what I'm looking for. A hospital is the place for me. Go take the quiz to confirm it. But you may also have watched this presentation and thought, I never really thought about it that way. Maybe the hospital really isn't up my alley. So you kind of have to evaluate it from your point of view here. Let's see here. Jennifer says, I work in psych. We are CNA 2s, and I love it. Awesome, awesome. Hi, Verlandi. Blue says, in Washington State, Miss Patty, I'll get you this. There's a CNA residency program that helps CNA learn the skills hospital need to know prior to hire. Yes. And Blue was telling me a little bit about that. And Blue, if you get me the information, I'll be happy to pass it on in one of my lives so that anybody in Washington State can apply to that program. Like what's a CNA role during rapid response, helping with Code Blues, general hospital life. Yep, absolutely. And Blue, I get it. I am running super, super crazy too. Hi, Patina. Baby B says, will this be recorded to review later on? Yes. I always record these. They're always available for review later on. So feel free to take a look at this later. Jennifer says, I do agree with that, Miss Patty. My first CNA job was at the hospital, and it was tough. People weren't patient with me, and I felt overwhelmed. Worked in a long-term care facility first would have benefited me. Yeah, and like I said, this is very individual, but I really wanted to kind of pull the curtain back and show you behind the scenes so that everybody can make a little bit more informed decision. And yes, I worked in psych for a couple of years. I absolutely love psych. Blue says, my first day as a CNA in a hospital, I had a grandma with a broken hip from a nursing home decide she was done with this crap and was screaming at me. I stole her car keys. Yeah, I know. It can be kind of crazy. I was 20. No one taught me how to react. That was 25 years ago, and I remember it so clearly. Yeah, I've been in some situations like that too, where you're like, what do I do? What do I say? And that's, experience is the best teacher when it comes to that. Baby B says, I passed my skills exam last weekend, ready to apply to hospital for benefits and flexible hours. Now y'all worrying be saying that they don't take an inexperienced CNA. Well, baby, they may. You can apply and see, but make sure that you meet this criteria. Make sure that you understand what you're going into, rather than just jumping straight into the hospital thinking it's the right place for you. They, depending on need, remember that critical need is what's going to play a role here. If they have a stack of applications and you're brand new out of CNA school and they've got other applicants that are more attractive with experience, of course the more attractive, more experienced people probably will get, and by attractive I don't mean appearance, I'm talking about on paper, they probably will get the opportunity. But that shouldn't, if the hospital is the place for you, that shouldn't, it shouldn't discourage you from trying, from applying. Okay, but congratulations on passing the state exam. That is awesome. Potato says you can still apply. She's just telling you what you need to look out before you apply. Thank you. It's a great way of explaining it. Jennifer says that's what my first CNA job was, mother baby. It was really overwhelming. Mother. I am not a mother baby nurse. Not for me. Not at all. When I did my time in the mother baby unit, we had the Hatfields and McCoys, two families that you could not have in the same place at the same time because they would literally fight in the hallway. We had a situation where two baby daddies showed up. They didn't know about each other. We had a dad that brought his brand new baby from another mother. It just was, it was chaos. It is drama central. Mother baby units are, and I'm just not a drama person. Now, granted, they did tell me when I did my mother baby rotation in school, they're like, it's not always like this, but it was enough for me. I decided it wasn't my place. Potato asks, how do you apply to be a nurse extern? It's you just apply. You'll see those opportunities in the job listing on your hospital's website. If they do nurse externs, it'll be listed there. And under the requirements, it'll say that you have to be currently enrolled in an RN program and have completed fundamentals of nursing. So you would just apply to that position if you meet that criteria. Otherwise, apply as a PCT. Alexa says, I have a question not relevant to working in a hospital. May I ask it here? I tried to call and talk to someone about the scrub store, but never got a call back. I'm sorry, Alexa. So Alexa, let me put my email in here for you. Send me an email. And I will, I do apologize for that. I have been super, super crazy. They probably passed your information on to me. I've got like 6 notes on my desk I still have to get to, and yours is probably one of them. But send me an email and I'll be happy to answer your question. Nino says, in Massachusetts, you need a license. I guess it depends on your state. Yes, it does. It does. Potato, no, you do not need a license to be a nurse extern. You're actually in nursing school. So it would be a PCT. They're just calling you something a little bit different. Again, there's a million names for direct care staff in a hospital setting. So it's just a different name for the same position. Okay. All right. Yeah, Alexa, just send me an email. I'll get your question answered. So let's get to, here we go. Follow us on social media. I'm actually starting to post a little bit on social media. I'm going to be implementing a brand new software to be streaming. I'm hoping to get it implemented next week. We'll see. Keep our fingers crossed. If not, it'll be the week after. It is a really, really cool platform. It's going to let me do a whole lot more really cool stuff with you. So follow me on social media, and that's where I will be announcing a lot of that. So does anybody else have any questions for me? Speak now or forever, at least until next week. Hold your peace. We are way late, guys. I am so, so sorry. Let's get to our congratulations. So this week, We want to congratulate the following people for dropping by our YouTube channel and letting us know that they passed the CNA state exam this week. And if you have tested and passed, make sure you go to our YouTube channel, drop a fresh comment on any one of my videos. Just pick one, doesn't matter. Fresh comment, not a reply to somebody else. I don't always see those. Fresh comment. Let me know that you passed. I'll be happy to congratulate you on an upcoming episode as well. And if you're getting ready to test, let us know that too, so we can send some good vibes out your way. So this week we are going to congratulate, Baby B. So congratulations, Baby B. Great job. Sabine Deer, Lashina Quince, 6391, Nicole Navarro, 7043, and New Homestead, 9608. So congratulations to all of you guys for passing the CNA state exam. We are so proud of you. We know you're going to do fantastic. Welcome to healthcare. Testing soon is Mela Lachey, and awaiting results is Jenny. So we're going to keep our fingers crossed, send some good vibes out to them as they're waiting for their results and testing soon. Okay, so this week coming up, I'll give you a rundown of what I got going on this week. Monday and Tuesday, I'm going to be at a conference over in Orlando talking to all of the long-term care facilities in Florida. So all 700 and some odd long-term care facilities, I'll be talking to their administrators, directors of nursing, and their staffing coordinators about how we can help them with all of the content that we have. So send some good vibes out to me on Monday and Tuesday. I'm going to need it. And then on Thursday, we'll be back live. If you didn't get to the game show 2 days ago on Tuesday, make sure you go back and watch that. We'll have that again the following week. So starting July 31st, that week, I'm going to be live 4 times. Monday for my class, Tuesday for the game show, Wednesday for class, and Thursday for you. So hopefully we'll get to see you during one of those live sessions as well. So hi Helen and hi Sarah. Make sure that you go back and watch the replays for what you missed. Until next time, guys, I'm going to sign off and let you get back to your busy lives. And I will see you here next week on Thursday at 3. Until next time, guys, happy care.